Alright, time for some practice questions. You've seen a few of these before, integrated into some of the earlier ones, but I put them in here as well just so we could kind of cover those again and keep them fresh. So go ahead and pause until you're ready to make your answer, and then go ahead and click back on. Alright, the correct answer here is E. So what we're talking about here is a perianal abscess. So we're going to be posterior to the urogenital triangle. So the area above or superior to the perianal space in the pararectal fossa is the levator ani muscle, and the puborectalis is a member of that group. Next question. Go ahead and pause until you're ready. Alright, hopefully everybody remembers from the first lecture, this is going to be D, the pubic bone. So D, pubic bone, is the correct answer, since that's going to be the area of the bony pelvis that hits that front part of the bike, causing that straddle injury we've talked about before. Pause. Alright, and what do you think it is? So an episiotomy, it's incision of the birth canal, usually posterior or posterior lateral through the vaginal wall, and that's going to be going through the puborectalis. That's the member of the levator ani group that is closest to that area. So E, puborectalis, is the best answer. If we had to go much further, some of the other muscles might become involved, but that would be pretty horrendous. Puborectalis is the member of the levator ani that's closest to both the rectal and vaginal openings. Okay, question number 4. Pause, restart when you're ready. Alright, this one's just a bit of a data question, knowing the layout of those fascial layers and those perineal spaces, but the erectile tissues are all in the superficial perineal space. That's E. So the deep perineal space is up above the perineal membrane, and the subcutaneous fat is superficial to the superficial perineal space. Just remember that that's where the erectile masses and their muscles are located. E, superficial perineal space. Question number 5. Pause, restart when you're ready. Alright, and here we are. The correct answer is C. Now the ejaculatory duct gets the products of the ductus deferens and the seminal vesicles. So B and D both lined up there, but they do it by combining into the ejaculatory duct. The ureter goes into the back of the bladder, and the bulbourethral gland is going to the urethra, but it's the membranous urethra below the prostate. So once again, C is the correct answer. Question number 6. Pause, let me know when you're ready. Alright, from the seminiferous tubules and rete testi, next thing up is the efferent ductules. So rete testi, and then the efferent ductules carry it from there to the epididymis. So B is the correct answer here. Question number 7. So take a moment, figure out what artery you think this tip of the arrow is pointing to, and then come back when you're ready for the answer. Correct answer is uterine artery. We can see it here going to the outside lateral wall of the uterus. It's passing superior to the ureter, so that makes sense there. The vaginal artery is a good distractor, but it's a little lower down here, passing deep or inferior to the ureter. So E is the correct answer. Same basic question. What vessel is the tip of the arrow pointing at? Pause and come back when you're ready for the answer. Alright, correct answer here is C, internal pudendal artery. So the internal pudendal is exiting and it's rolling inferior to the levator ani to get to the perineal area and the genitalia. We have the middle rectal a little bit above it, even though that wasn't labeled. The inferior gluteal is this artery here. Superior gluteal is right here. Inferior vesicle is going to be this artery traveling to the underside of the bladder, so it's way up here above the levator ani, inside the pelvis. And who am I missing? Superior vesicle. That's going to be traveling right here off the umbilical. Testicular artery would be way up high coming off the lumbar, so that's not correct either. Once again, C, internal pudendal. Question number 9. Pause, come back when you're ready. Alright, so correct answer is B. So remember, on the right, the gonadal veins, testicular or ovarian, as well as the suprarenal vein, drain directly to the inferior vena cava, but on the left, further away, they have to drain to the renal vein. So the left renal vein gets the left gonadal vessels and the left suprarenal vein. So gonadal vein and suprarenal vein on the left go to the renal, but on the right they go straight to the inferior vena cava. B is the correct answer. Question 10. Let me know when you're ready. Correct answer here is A. The cardinal ligament or transverse cervical ligament is the place that you find the uterine arteries going to the uterus. So the perineal membrane is much more inferior. That's going to be between the perineal space and the pelvis itself. Pubocervical and sacrocervical are the other two ligaments that anchor the cervix, but they're going to be more anterior and posterior, respectively. And the sphincter ligament of the ovary is the ligament that's formed by the perineal lining covering the ovarian arteries on their way to the ovary. So the uterine arteries themselves are found in A, the cardinal ligament. Question 11. Pause. Let me know when you're ready. Alright, correct answer here is B, the infundibulum. So the infundibulum is the most distal part. The fimbria are the little finger projections coming off the infundibulum. I didn't list those in particular because that can be confusing, but the infundibulum is the actual part of the oviduct with the fimbria extending off of it. Question 12. How does urine get from the kidney to the body? Take a moment, we'll run through all these, and let me know when you're ready. And the answer is D. Minor calyces drain to major calyces, which all converge on the renal pelvis. Renal pelvis narrows down to become the ureter, which goes to the bladder, which goes out to the urethra, and then outside. Question 13. Pause. Let me know when you're ready. Alright, the paranephric and perinephric fat, sometimes also called the pararenal and perirenal fat, are separated by the renal fascia, C. The renal capsule is on the outside of the kidney itself. The renal fascia is what surrounds the kidney and the underlying perinephric fat, and then the paranephric fat is external even to that. Question 14. Pause, come back when you're ready. Alright, the area that we're talking about, the internal lining of the uterus, is the endometrium. So endometrium and endometriosis is what's being described here. The myometrium is the actual muscle of the uterus, and the epimetrium is the outside lining of it. Parietal peritoneum is going to be covering part of the fundus and body of the uterus, but it's the endometrium, A, once again, that's going to be the causative problem here. All right, next question. The medulla of the adrenal gland secretes what? Secretes epinephrine. So the cortex secretes the glucocorticoids, gonatocorticoids, and mineralocorticoids. So epinephrine is the correct answer here. Question 16. Pause, come back when you're ready. Alright, it's bending posteriorly, so we're going to know that that's retro, one way or the other, and it's in the middle of the belly or its body, so that's going to be retroflexion, C. Retroversion would be if the entire uterus is hanging posteriorly, but since it's bent, that is retroflexion. Question 17. Alright, so how does lymphatic fluid flow? If it's at the external iliac lymph nodes, it wants to move more proximally, and the next set of nodes that's proximal will be A, the common iliac lymph nodes. Internal iliac lymph nodes also go to the internal iliac. Deep inguinals actually go to the external iliac nodes, which then go to the common iliac. And then from common iliac, we'd wind up at the lumbar area here, and superficial inguinal are way on the outside. So after all that, once again, A is the correct answer here. Question 18. Pause and let me know when you are ready. All right. Where does the lymph from the testes and the ovaries drain? It drains pretty much straight back up its blood supply to the lumbar lymph nodes. So the blood supply is coming from the aorta, and the lumbar lymph nodes are the ones that tend to catch tumors from the testes and ovaries. So once again, D, correct answer. Question 19. Okay, how does visceral pain from the prostate get where it's going? Is the prostate above or below the pelvic pain line? It is below. It's not covered by peritoneum, so all sensory from the prostate, painful and non-painful, will be traveling back along the parasympathetics, which are in this case the pelvic splanchnics. C is the correct answer. Question 20. Now, these are tough questions, so let's break this one down into its component parts and answer those. Where are the postganglionic nerve cell bodies that supply sympathetic innervation to the ascending colon? All right, so we know it's sympathetic. We're looking for postganglionic. They have to be in a peripheral ganglion somewhere. So E and F are out. It's not in the central nervous system. If it was preganglionic, E and F would be our best shots. So E and F are out. Ascending colon. Where's the ascending colon coming from? It is either a foregut, a midgut, or a hindgut organ. It is a midgut organ. Ascending colon is midgut, gets its blood supply from the superior mesenteric artery, and superior mesenteric ganglion is where we would find the sympathetic nerve cells containing its postganglionic sympathetics. So D is the correct answer here. Question 21. Alright, this is just one you need to know. Now, the best answer would be neural crest cells. I didn't give you that option. I mean that way. Sorry about that. I'll try to be nice in other ways. So where do the neural crest cells go? They go to the wall of the organ. That's going to form postganglionic parasympathetic nerves. So B is the correct answer to this question. Question 22. So, what do we have here? We've got the ductus deferens. What does the ductus deferens originate from? It is coming from the mesonephric ducts. Mesonephric ducts are going to form the internal plumbing of the male. So the testes drainage, not the testes themselves, but like the efferent ductules, the epididymis, the vas deferens, and the seminal vesicles, all coming from mesonephric ducts. Metanephric duct, you have a metanephric bud that creates the ureter and kidney. The paramesonephric ducts create the female internal plumbing, so oviduct, uterus, and the very most superior portion of the vagina. And the pronephric ducts make nothing. Question 23. Alright, what failed to form? What has to form to create a kidney? The ureteric bud, that little bud off the mesonephric duct that forms the ureter. E has to form, otherwise no induction of a kidney will happen. Question 24. So we have discharge from the urine. Now if we have a connection of the gut tube at the ileum to the umbilicus, we could wind up with a Meckel's or an iliodiverticulum where food and fecal material might be passing out. But this is urine. What that's telling us is we have a urachial fistula. So B is the correct answer there. Connection between the bladder and the umbilicus. Question 25. So XY equals male. Male chromosomes. But androgen insensitivity means that no matter how much testosterone or DHT we pump out, they won't have any effect on the tissues. So this person will develop in what's called hyperfeminine ways, since there's nothing but estrogen affecting the tissues. And last but not least, question 26, failure of the urethral folds to close in a female infant will result in E, normal genital appearance. Those urethral folds seal together on the midline to create the penile raphe, and if this was a male, we would have hypospadias. But since this is female, Failure of those folds to come together on the midline is normal. All right. It's been a pleasure. I look forward to talking with you guys on Zoom very soon, and look for announcements coming from Dr. Rice, Professor Rice, and I hope you guys are having an excellent day.